This is Dr. McDaniel at GYN Corner. I made sure the microphone's locked in today, so we're not going to have any sound issues, I trust. Sorry. And today's Friday, so TGIF. Looks like it's going to be a nice, hazy, hot, and humid day here in New York, New Jersey area, which is my favorite type of weather, so it's perfect. As the title stated, I'm speaking on Bartholin, the Bartholin's gland again. So yesterday, just to give a brief recap, the Bartholin's gland is a secretory duct or lubricating duct for the vulvar vaginal areas. The Bartholin's gland is a little bit smaller than a green pea, and there are two of them, one on each side of the vaginal opening. They have little pores or ducts or holes that allow the secretion, the lubricating fluid to ooze into the vaginal opening itself. So with any kind of sexual stimulation, the Bartholin's gland secretes that fluid to lubricate the vaginal opening and the vaginal vault. Those ducts have a very, very tiny pore or opening, so they can relatively frequently, can and will relatively frequently get clogged up. I would say approximately, they seem to come in waves, but over the course of a year, I'll see maybe 10 to 12 women or so with the Bartholin's gland issue. On average, maybe 15 with the Bartholin's gland issue. So it does seem to affect about 15 to 20% of women. The Bartholin's gland can get clogged up, and the fluid or the secretory liquid can get backlogged. If it gets backlogged without trapping a lot of bacteria, we call it a Bartholin cyst, and that's because it's just a pocket full of that lubricating liquid. So a pocket full or a bag full of liquid is always called a cyst. The Bartholin cyst is not a health issue, it's just an inconvenience. If it's relatively small, a lot of women won't notice it. It doesn't cause any pressure, pain, discomfort. But if it gets larger, they will notice it. And as I mentioned yesterday, sometimes it can be quite embarrassing. It'll look like there's a testicle or an egg or something in the lower part of the outer lip, the labia majora, the fat outer lip of the vulva. That duct can get clogged up whenever there is increased friction with increased liquid or fluid in the area. Classically, it's due to chlamydia gonorrhea. So technically, whenever someone has a Bartholin cyst or an abscess, they should be tested for chlamydia gonorrhea, because those are the only two infections that can cause inflammatory changes, and inflammatory changes can cause scarring. So they can block up the duct with inflammation and scarring. But non-sexual infections, because chlamydia and gonorrhea are sexual infections, but non-inflammatory diseases or phenomena can clog up the pores. So I've seen over the years, if someone's sweating a lot, there's just a lot of wetness in the area, or if they have a frequent or heavy or a constant vaginal discharge and they have increased friction. So sexual activity is the most common. That's a lot of friction, and oftentimes I'll get the story that they went on vacation, or they got together with a out of town or out of the area boyfriend, fiance, husband, whomever. They had frequent intercourse every day or a couple times a day, and then suddenly they started having this discomfort and swelling. Because if it is a cyst, it does get larger and larger, and it is uncomfortable, just not painful. So if it's a cyst, increased friction along with liquid secretions can clog up the duct or the pore, and then of course with sexual activity or sexual arousal stimulation, the gland will continue to produce the secretory liquid or the mucousy lubricating liquid. It will not be able to egress or to leave the gland, so it will backlog and pile up or build up into the Bartholin's gland itself. It's going to be a cyst. Now, if bacteria gets trapped in with it, then unfortunately it will turn, sorry, I'm trying to do something. Unfortunately, it will turn into an abscess. So an infected cyst or an infected pocket of fluid is an abscess, and it's going to be filled with all of the bacteria in that area. So bacteria that's natural or common to the vaginal vault, bacteria from the surrounding skin, and bacteria from the intestinal area. So 3 different areas of bacteria. An abscess is by definition a pocket of infected fluid due to bacteria, and it's going to be purulent or full of pus. So an abscess, because it's an infection and an inflammatory process, it will be exquisitely painful. So usually I'll get the story that either during or shortly after intercourse, one side or the other of the vaginal opening begin to feel tender or uncomfortable. That tenderness or discomfort increase started to become quite painful, and then the lady started to notice a tender lump or a ball. Most women who are fairly astute will come in straight away, so that Bartholin's gland that's infected will usually be about the size of a marble to maybe an acorn when they come in. If they're not very astute or they tried the DIY, the treatment, they're going to come in like one of the ladies yesterday. It was the size of a peach, 5 centimeters. And she could barely walk and could barely sit. So quite painful. Now, what you can do if you know that you have some discomfort or tenderness, and you know that's not normal, and you see there's a swelling in the area, you could immediately start taking soaks in the tub, or a hot soak in the tub, or putting a hot washcloth on the area, because heat will potentially draw out the infection, allow it to drain quickly, naturally on its own. If that doesn't work within a few hours or a day at the most, it's best to just come on in, because an abscess is it's going to be a myriad of bacteria that's forming a purulent inflammatory process, an infection. You're going to need antibiotics. There's no way around it. Traditionally, we prescribe 3 antibiotics for an abscess to cover the 3 different areas of bacteria, including bacteria that like to live in an oxygenated area like the skin versus bacteria that like to live in a non-oxygenated or anaerobic area like the vaginal or intestinal areas. So we like to write 3 antibiotics, and we'll need at least 2 antibiotics to get the job done. I have seen patients who have actually seen a doctor, usually not a gynecologist. Usually they've gone to urgent care or the emergency room, or they've seen their primary doctor and they've been given 1 antibiotic, which I don't understand. I think all doctors should know an abscess always requires at least 2, an anaerobic and an aerobic bacterial fighting antibiotic, but ideally 3. So I'm really surprised when I see someone coming from the doctor, they were given 1 antibiotic, and for whatever reason they're always given doxycycline. I don't get it. But of course they come to me because it doesn't work. They felt a teensy bit better, but they're still infected and they're still in pain. So take-home message is never accept. First of all, don't see a non-gynecologist for a vaginal vulvar problem. Just go to a gynecologist. Don't go to urgent care in the emergency room. They're not used to dealing with bread and butter type of problems. Like, this is a bread and butter GYN issue. They're really not used to dealing with it unless they've been paying attention, if they've been speaking with gynecologists, or they've seen it a few times, they've gotten feedback. If that's not the case, and you can't always count on that happenstance being the case, it's best to just call a gynecologist. I see patients as walk-ins. We have walk-in non-appointment hours every day we're here. Today's Friday. I have walk-in hours till noon today. So every single day I have walk-in hours for urgent problems and for infections, bladder infection, vaginal infection, this Bartholin's abscess infection. You can just call for the walk-in hours. I see patients every day as a walk-in. Just come in during the walk-in hours without an appointment. I'll see you. So if it's a Bartholin's abscess, it does need to be treated. I'm going to go into the treatment of the Bartholin's abscess tomorrow. We're not at the horse farm tomorrow because Nina, the teacher, is out tomorrow. So I'll probably be coming from home tomorrow morning. But thank you for watching. This is Dr. McDaniel at GYN Corner. It's Friday, TGIF, July 12th. Please check out the YouTube channel. There should be there is a link. I placed a link on our Facebook page here. I think it's in the About section because I couldn't find anywhere else to place it. But you can just click the link there in the About section. It'll bring you straight to the YouTube channel, or just go to YouTube and type in GYN Corner. We have all of the talks since April. I've been doing daily talks. I've only missed one day, and that was when I came back here from my trip to Europe recently. So I've posted every single day since April, except for one day. And please check out our website. MidtownGYN.com is our website. I also have links to the Facebook and the YouTube on our website. Have a great rest of the day. Thank you, and I'll be back tomorrow to talk about Bartholin's abscess. Bye.